First off, welcome everybody to this webinar. Today we're going to be chatting about VillageReach's evaluation results from their Drones for Health program in the DRC. So we can kick it off. So before we start, just a couple of housekeeping items. So my name is Kat James. I'm the community manager of the UAV for Payload Delivery Working Group, and I'm going to be facilitating the webinar today. Before we get started, just to let you know that this webinar is going to be an hour in length. There's going to be 45 minutes of presentation with a 15-minute Q&A. So if you have any questions throughout the presentation, you can put them in the chat, and then we'll have time to answer them at the end. This webinar will be recorded, and I will email it out to all of the people who've attended, as well as put it on our website. We really would love for there to be a lot of lively discussion during this webinar. So there are two different ways you can participate. Throughout the webinar, you can drop your comments in the Q&A section. And then Olivier or myself will make sure that they're addressed either before or after the webinar, or during or after the webinar. Or during the Q&A portion of the webinar, you can raise your hand and I'll ask you to come off mute and you can share your question. So great, without further ado, I'm excited to introduce our speakers for today. To start, we have Olivier Dufoy, who is the Director of Private Sector Engagement for VillageReach, as well as the Drones for Health lead and the founder of UPDWG. We have Dr. Archimed Makaya, who's the Drone Program Manager for VillageReach's Drones for Health program in the DRC. And we have Gabrielle Ailstock, who is a manager in private sector engagement at VillageReach, and who's done a lot of work on the Drones for Health team as well. So without further ado, I'm going to kick it over to Olivier to get us started.
Well, thank you, Kat, and welcome everyone. Before digging into the main topic of the subject, I was going to present to you, introduce you who is VillageReach and why, most importantly, why did we started working on the drone delivery sector. So VillageReach's mission is to transform healthcare delivery to reach everyone so that every person has the healthcare needed to thrive. And we develop and co-develop in partnership with governments, academia, and the private sector, solutions that improve equity and access to primary healthcare. And this solution falls into two primary areas: getting health product to people and creating new tech-enabled pathway to primary healthcare. And under the product to people, VillageReach has an extensive portfolio of supply chain innovations that ensure supply of life-saving vaccine and medical product are demand-driven, accessible, and responsive to community needs. Over the past 2 decades, we've seen incredible improvement in health, yet inequities and gaps in health coverage persist for many people. And it is to address this equity gap that 7 years ago, VillageReach started exploring the use of uncrewed aerial systems or drone. Next slide. Up to today, the health supply chain are relying on land and water-based mode of transportation. But we know that in limited resource setting, these traditional mode of transportation are not adapted to poor road infrastructure and the remoteness of certain locations where communities live, resulting in lengthy and sometimes unpredictable delivery or pickup time. Next slide. And this is where the value proposition of drone becomes clear: a fit for purpose, adapted transportation modality to operate at the last mile and reach the underserved location and their communities. But drones are not a fit for purpose and adapted in every condition, which is why drones are only an additional, a complementary mode of transportation in the last mile supply chain toolbox. So at VillageReach, we help governments and partners design, implement the supply chain of the future, one that uses fit-for-purpose mode of transportation to ensure an efficient and equitable routine and emergency supply chain. Next slide. And to make logistically complicated health intervention more manageable. Like during last year, yellow fever mass vaccination campaign in the DRC, where drones delivered cold vaccine multiple times a day as needed in a matter of 20 to 30 minutes, rather than once a day or once every few days following a multi-hour journey by land, risking the quality of the vaccine. Next slide. Today, VillageReach oversees drone transport networks in the DRC, the Mozambique, and Malawi, and have provided targeted technical assistance in the Dominican Republic, Central African Republic, and Kenya. Next slide. Over 6 years of experience implementing drone transport projects, from small pilots to larger one, like a national scale-up in Malawi, allowing us to refine our approach and the methodology to successfully integrate drone transport into health system, from assessment, design, planning, getting all the regulatory authorization, working hands in hand with civil aviations, setting and operating the day-to-day operation. Next slide. So if you or your government or a partner of yours are considering the use of drone as a fit-for-purpose additional mode of transportation to address a transportation problem, don't hesitate to reach out. And without further ado, let's hear from Dr. Ashimed Makaya about one of the largest bi-directional drone transport network in the world. Dr. Ashimed.
Thank you so much, Olivier, for the floor. Good morning and good afternoon, ladies and gentlemen, according to your time zone. First, before sharing the evaluation result, I want to give you the background of the drone for the health in DRC. Equator province, where we are working now, is one of DRC 26 province, which is 4 times bigger than Rwanda Republic. Its population is scattered in the Equator forest, along majestic Congo River and its tributaries. The multimodal transportations are needed to reach the remote locations. As an example, Botswana.
Sorry, Dr. Ashimed, I think you got to switch, the slides. So, Dr. Ashimed, make sure you ask for next slide when needed.
Yes, yes. I want to remain in the first slide. Then we will move to the next.
Yeah, okay. So I think you're on this one.
Yeah. So the multimodal transportations are needed to reach the remote location. As an example, Botswana, where 3 modes of transportation should be combined. To reach Botswana, you need 4 hours by car from Bandaka to Bikoro, then 4 hours by boat to cross Lake Tumba, then walk for 3 hours by feet between Mpili to Botswana. Then you reach Botswana. So in 2019, the Minister of the Health, in collaboration with VillageReach, has designed the Drone for the Health program to address these challenges. Next. DRC has the largest bidirectional drone network in the world for the health product. So let me repeat it again. DRC has the largest bidirectional drone network in the world for the health product transportations. It serves more than 10 health zones, 40 health facilities, and more than 400,000 people via 24 learning sites. Next. You want to move next? Next.
Up, I think that there might be a delay.
Of the health. Okay. The Minister of the Health has chosen two modes of transportation to serve the population living to the remote areas. The first is the scheduled and the mandatory transportation, and the second is the drone transport on demand. So the health products that have been transported by drone are mainly vaccines for the children and also the pregnant human, and the lab sample infectious disease such as tuberculosis, HIV, measles, yellow fever, Ebola, COVID-19, and polio, etc. Next. So with more than 4,000 flights conducted during 2 years, more than 400,000 people have been reached indirectly, including children, pregnant women, health workers, and community health workers. This is just the background for our current drone network. So now let us move to the cost and performance evaluation result. Next. So drone integration to the DRC public health supply chain often has an opportunity to assess if drone transportation could help to improve the availability of the health product to hard-to-reach areas. The performance and economic evaluation has been conducted by Kinshasa School of Public Health and Hopesment in collaboration with UCLA, Heidi Inside, and VillageReach. I'm going now to present the performance evaluation, which has been conducted by Prof. Joel Konde from Kinshasa School of Public Health in collaboration with Prof. Nicole from UCLA and VillageReach team. Then my colleague Gabo will be presenting to you the economic evaluation. Next. According to the Minister of the Health Week, this evaluation will answer to the following question, which is also the main goal of this study. How best to improve the scale-up health product drone transportation in the remote areas? The type of key performance indicators below have been used to measure the performance. The first is the supply chain. The second is the immunization service delivery. Then the health workers and community satisfaction. This study is an experimental one with the single group where data have been collected before and after integration. Next. Data have been collected for time in the targeted facility, as you can see in this slide. Next. The result will be presenting in 3 components. The first is for supply chain indicators, immunization service delivery indicators, then health workers and community satisfaction. Overall, supply chain KPIs are green, as you can see, because all indicators are over the Minister of the Health objective. To give you details on it, for example, the vaccine availability, as you can see, the vaccine availability has been increased from 65 to 98 at the end line. For the stockout, for example, the yellow fever vaccine stockout has been decreased from 18 to 0 to the end line. And as also you can see, the lab sample referencing system has been improved. As an example, the percentage of polio lab sample arrived within 48 hours to the provincial level increased from 35 to 69. Next. High health workers and community satisfaction, but no more change for the percentage of vaccination session organizing according to the plan, because more vaccination session has been planned and conducted after drone introduction. The vaccine coverage decreased a little bit due to the health worker strike during 6th month and the Ebola outbreak the last years and the COVID-19 also. So what are limitations? Next. For the evaluation, no control group, just a small sample size or facility, and also work availability and quality of data. For result, health worker strike, as I have already mentioned, Ebola outbreak and COVID-19. Sometimes also we had the ground transportation as backup during the period of interruption. Then the lack of the drone equipment and the frequency delay on the flight authorization. So I will now invite my colleague Gabriela to continue with the economic evaluation, then we can share the conclusion. Thank you.
Thank you, Dr. Archimed. My name is Gabo Ailstock, and I'm very excited to share with all of you some of our high-level results from the economic evaluation that complemented this performance evaluation. And this economic evaluation was done in partnership with Noel Watson from OpsMend. Next slide, please, Kat. So our evaluation is the first to ever publicly evaluate the cost or cost effectiveness of using drone transportation in health systems. And that's the actual cost. There's been a lot of studies that have been published that have used modeling or used estimation to look at the potential cost of drone transportation, but we wanted to move past modeling and estimations. So since we were the first to do this, we wanted to evaluate the comprehensive cost of introducing and operating drones in Ecuador and to investigate if the cost was worth it. So to reach this objective, we included 3 separate but important analyses in our economic evaluation. The first that I'm going to talk about was a startup cost analysis. And the purpose of this was to identify the initial costs that VillageReach incurred as the implementing partner to introduce drones in Equator Province. And these costs were very important to document so that we can plan and budget for scale up of the solution to other provinces, other countries, and to plan for our recurring costs in the future. Second, we will go through the immunization supply chain costing component of our study. And in this component, we costed the actual operating cost of the traditional land-based supply chain before drones were introduced, and then again after drones were introduced, so that we can make a direct comparison. And this supply chain cost analysis did not include any of the startup costs that were incurred by VillageReach, but were really more so from the government perspective of what does it actually cost to operate the immunization supply chain. And finally, we did a cost effectiveness analysis to answer the question if the costs are worth it. And here we used the results from the immunization supply chain costing analysis and the performance evaluation results for our cost effectiveness analysis. Next slide, please, Kat. So let's get started with the startup cost. Here, we documented these costs into a number of categories that were based on the activities that were required to begin using drones in Equator Province, which you see here on the screen. And interestingly, when we first started and we were writing our methodology, we thought that most of these activities would really be one-time costs. But we found out as we implemented this project over the next 2 years that many actually were recurring costs through the implementation, although at a much reduced cost level and at a much lower activity level. So training is a perfect example of this. We incurred the majority of our training costs before drone flights started to train all of the health workers in the network. But after we started flying, there was some turnover of the health staff at the facilities, which happens very often. So we had to redo some of those trainings at certain facilities, but at a much lower cost from the initial training. Next slide, Kat. So now here we see the total or the average monthly startup costs. And we broke down these startup costs into 3 time periods. The pre-implementation period, which was before flights had actually started. The scale-up period after flights started, but had not reached all of those 24 drone landing sites yet and not serving all 40 health facilities yet. And then finally, the steady state, which is when we had reached all those 40 health facilities and we were operating at scale. And we see that the average monthly cost was highest during the scale-up period, but was reduced very significantly once we reached that steady state. And these steady state costs are really important for us when we are planning and budgeting for our operating costs moving forward and our recurring costs, while the pre-implementation and these scale-up costs are really important for us to consider and think about when we are planning for scaling the solution to other provinces, other geographies, or even other countries. And we also saw that one of the largest cost drivers in this analysis was the actual cost for doing these evaluations. And this is really important for us to separate out for a few reasons, but one of them is because really robust evaluations like this may not always be required moving forward in Equator Province, but they may be required potentially in other provinces in DRC or in other countries. So we wanted to pull those out so that we could see what was that true cost of the evaluation in order for us to close these evidence gaps. And now we're going to move on to looking at the operational costs of the supply chain. And next slide, please, Kat. So here we see the results from our immunization supply chain costing analysis, which, as a reminder, these costs do not include those startup costs that we just looked at. And these focus on the cost to actually operate the immunization supply chain in Equator Province from the government's perspective. We found that the total supply chain costs at N-line increased after we introduced drone transportation, but this wasn't very surprising to us because we know that the cost of new technology is historically high. When you think of cell phones or when you think of solar panels, the cost was prohibitively expensive when that technology was first introduced and hadn't reached scale yet, but it decreased significantly once it did reach that scale. And we see a similar trend here with drone technology. we've already seen the costs start to come down. But we also have to remember that although the cost increased, our supply chain performance greatly increased as well too, which we saw in the performance evaluation results. Next slide, Kat, please. But interestingly, we saw some transportation cost savings at the zone level or the district equivalent for DRC and at the health center level. And this was due to the zones and the health centers no longer needing to travel themselves to collect immunization products monthly, since the drones were directly delivering them from the provincial level. But you might be wondering why the transportation costs, particularly at the health center, didn't completely drop to zero, since we were only using this drone transportation. And as Dr. Arshiman mentioned, the health centers were actually able to start going out into their communities and vaccinating folks away from the health post more, now that they had time freed up from not having to do their monthly transportation to the zone level. And so that came with a cost and a transportation cost to continue doing that vaccination sessions away from the health post, but it's a very positive change in the health system. So we were very excited to see these results actually. Next slide, Kat, please. So now we're going to dive into the results from the cost effectiveness analysis to see if this increase in performance was worth the cost. So we took our measured cost, which you see here as the cost per dose, and we took the measured effectiveness, which we created a multi-metric score from the supply chain performance evaluation. And then we calculated how much does it cost to reach each unit of that effectiveness, or each percentage point, both at baseline and at end line. So at baseline, it cost around $7,000 to reach each percentage point of effectiveness, and at end line, it cost $10,000. So this meant that the intervention was not yet cost effective. But since this technology continues to evolve, and we've learned a lot about how it can be used over these past 2.5 years, we wanted to see if there's potential to reach cost effectiveness, since it was such a transformative intervention for the supply chain performance. So next slide, please, Kat. So through our data analysis for this evaluation, we noticed that the drones were flying for less than 20% of the time that they should have been available. And this low asset utilization was one of the factors driving up the higher cost. This low utilization was driven also by some of those operational bottlenecks which Dr. Arshiman mentioned, like the lack of equipment that we had or the delays in flight authorizations. But these are surmountable challenges. So if we're able to address those bottlenecks in the future and increase our asset utilization from 20% closer to 50%, this could allow us the flexibility to re-optimize and reconfigure the drone transportation system in order to reduce costs and really optimizing it for cost reduction. So we did some estimations on what the cost and the cost effectiveness could be if we were able to reconfigure that drone transportation strategy to reduce costs. And so you see this here in this improved end line, which is an estimation, where we estimated that the cost effectiveness would then be reduced to around $6,500 per percentage point of effectiveness, which is much more comparable to our baseline. And as a reminder, this estimation only assumes that the asset utilization increased to closer to 50%. So if we can keep driving that asset utilization up even further, closer to 70, 80%, the cost could keep coming down. And so we see a really huge potential to be cost effective in the future if we can make some improvements to the system. The next slide, please, Scott. So one approach to increase this asset utilization that we're already working on with our drone service provider partner, Swoop Barrow, and the Ministry of Health is a new market development strategy with the aim of unlocking more affordable drone logistics services for DRC and other places in the world. And we're really focusing on doing this through 3 levers. The first is moving beyond the public health sector so that other sectors can utilize the existing drone network. The second is further refining the business model of the drone service provider. And the third is scaling from this existing network so that we can start reaching more economies of scale. And we're really hopeful and excited about what we learned through this economic evaluation, and think that our lessons can be translated to many other implementers and drone service providers around the world, so that they can also start working to make drone services more affordable in the near future. So thank you so much, and I'll turn it back over to Dr. Arshimed to close us out.
Thank you, Gabo. So what is the conclusion? Next slide. Yeah, drone delivery of the health product to the remote location is quite efficient. As we have learned, this system increased the health product availability. It reduced the vaccine collection time, and it improved the lab sample referencing system. And the drones are well liked by the public, community in the villages, also the health workers. However, currently, as Gabo mentioned, the system is not cost effective, but there is a potential to make it cost effective. Next slide. That's why DRC Drone for the Health program has been developed a strategic plan according to what we have learned. First, for an optional use to improve the cost effectiveness, the government of DRC is committed to create the drone enabling environment and also diversify the product being transported by drone. They want also to optimize the schedule and the drone network configuration more flexible. The government wants also to expand the drone F transportation program to other provinces in DRC and improve the maintenance and supply chain local capacity. Next step, please, Kat. According to the priority of the government, the entire provincial drone network, Maindombe and Equateur, has been designed and will be operational in the second semester of 2023. Next month, 8 drone academy instructors will be trained at the Senegal Drone Academy to Senegal to meet the local demand for the drone operators. The Congolese government authority are working hard to set up the National Drone Steering Committee. Next. As Olivier mentioned, drones are supplementing the existing transport system. They are used essentially for the hard-to-reach locations, sensitive products, as a vaccine, emergency situation, frequent and on-demand delivery or pickup. And we are happy to let you know that the next week, the lesson learned on the health product transport by drone in DRC will be published in the Vaccine Inside article. Thank you so much for your attention.
Great. Thank you all for that wonderful presentation. And Now we're going to open the floor to some questions. I saw a lot of activity in the chat. So for those of you that raise your hand, I will help unmute you so you can come forward. Or actually, if Olivier, no, here it is. Olivier, do you want to take the first round of questions?
Oh, you're muted, Olivia.
Sorry about that. Anybody wants to ask a live question can just unmute themselves and just come in. I noticed there was a hand or two raised. If that was to ask a question, feel free to come and call and ask a question verbally.
I think I have to unmute them, but it's not showing up as an option, so I might stop sharing my screen for a second to see if that helps. So I will be back.
So a lot of people were asking about how did you choose Super as a drone service provider that we used. I did answer the question in the Q&A chat, but there was an extensive evaluation process, started with open tender, international open tender. We have many response from many drone service provider or OEM. And we then had a committee, an evaluation committee with aviation experts, civil aviation authorities, health, logistic expert, and so on. Really do a thorough evaluation of each of the application, and with a couple round of evaluation, which then ended up with choosing Super. That was about two years, more than that, 2+ years ago. That methodology is available on UpDog into the resource section.
I just put it in the chat, actually.
And even better, thank you, Gabo. So that was regarding how did we end up with that. Somebody asked, Michelle Ilan asked us some good question. How economically viable is this mode of medical delivery? How much are the charges for transportation? And is the government bearing the cost, or is it the individual hospital? So those are some of those questions were answered during the webinar, during Gabo's presentation. But Gabo, maybe you can jump in and add some additional comment.
Yeah, so I think we answered more of the first one later once we got to the cost effectiveness analysis about the economic viability and the real potential that we see there to really drive that cost effectiveness up. So for who is paying for these costs, and I saw some other questions around that, it's a combination right now. It is done in part through government donor-backed budgets, like through the Gavi HSS, the health system strengthening budgets, and through a combination of VillageReach's donors as well too, that is collaborated with the government to fundraise so far for the implementation. And it's not the responsibility of the health facilities, the health centers, or the zones to pay for that transportation. Since we're consolidating that cost of the transportation at the provincial level, it's the province's responsibility then to pay for that transportation. So we're seeing some of those costs get shifted from the health centers and the zones, and particularly for the health centers. Previously, they would pay for their health workers to go and collect products out of their rotating operating budgets at the health center. So I think it's a really positive change that's coming out of the health center budgets now.
And then one question that John asked in the chat was, what do you see as the biggest barriers to scale at this point? So maybe Olivier or Gabo, you can speak to that.
I think Dr. Archimed should actually.
Yeah, Dr. Archimed, that one is for you.
Yeah. For the moment, the technology that we are using is able to carry 5 liter of volume and a maximum 3 kgs.
Dr. Ahmed, the question that we wanted you to answer is, somebody is asking, what is the biggest barrier to scale? What do you see being the biggest barrier to scale today in DRC?
Oh, thank you, Olivier, for this question. The main barrier for the moment is the regulations. Currently in DRC, we have many zones where we can't fly because we have many restricted zones. This is one. And also we need to recognize that we still continuing building capacity and working together with Civil Aviation Authority to update our regulations, because as we mentioned it during the presentation, we got many delays in terms of getting flight authorizations and so on. Another one maybe should be the technology, because as I have mentioned it, only the province of Equator is bigger 4 times than one country as Rwanda. So to fly from one location and another, it can be more challenging for the technology we have now, where we have only, for example, 100 kilometers that we can reach. So these are some limitations, I can say, but we are trying to do what we can to improve and scale. Thank you.
Maybe I can jump in and complement. You know, DRC on its own is gigantic. And so a lot of provinces now want to scale in their provinces, but there is a limitation of the capacity, the actual capacity of the current provider, because the size of the country. So, you know, we really open to work with other drone service provider or OEM, I mean, to help government really scale that drone transport across the entire country. The last point I wanted to emphasize is also coordination between health department is also something that we are continuously working on, because the drone is not made to transport just vaccine or just one type of product. So we need to work hands in hand, the DPS, the drone service provider, and the funders have to work together to agree that for those hard to reach facility where drone is an actual fit for purpose and adapted mode of transportation, any health product, no matter if it's malaria, HIV, lab or whatever, should use the drone transport services and apply this cost sharing approach, which then will help with the financial aspect, and so make it even more attractive beside the value added of drone in this kind of environment. So that's another coordination among the different health departments and their associate donors is also something that we are working on to help with scale. Go ahead.
Yeah, one more comment. The human resource. Until now, we're still struggling because we have the lack in terms of the local human resource in drone expertise. That's why we are working hard with the government to set up a drone academy where we can increase the number of people to address the big demand of DRC.
Great. So now we're going to take a live question. So Stephen, I see that your hand is raised, so I'm going to unmute you and you can ask your question. You should be able to unmute yourself now.
So maybe while you figure, Stephen, you got to unmute yourself if you want to ask a question, but there is several questions that address utilization. And maybe that will be for you, Gabo. As mentioned, the utilization was low. What was the reason for this low utilization, and how are we, and when do we think utilization could be reached 50 or even over 50, which is where the cost effectiveness started to be looking very promising?
Yeah, so we had a couple of reasons identified for this, but I think one of the more interesting ones is actually about how we set up the system to adapt it to be able to deliver products to these facilities that don't have cell phone connectivity. So in most other drone projects around the world, a health facility can send a text or a WhatsApp message to the drone operators and say, hey, I need products. Will you send it? And you can send it tomorrow. Everything is great. But in our case, we couldn't do that because these health facilities have no cell phone service. So we had to make very tight scheduling windows that every month these facilities would get their products in this 2-day window. And the drones would come, the health workers would put out the QR code if they're available to receive the drone delivery. And there was no communication between the end health workers and Swoop Arrow. So I think that's really cool that we found out a way to do that. But that also decreased our asset utilization because let's say in one part of the drone network, there was a lot of rain that day. We couldn't just say, oh, there's a lot of rain here today. Let's deliver these products down south instead, because we have no way to contact that health facility and say, hey, we want to deliver the products today instead of 2 days from now. So I think that sort of really tight scheduling window is something that we can iterate on a little bit more and see where we might have some more creative solutions to be able to be a little bit more flexible within our system while also considering these communication challenges. And then for how long it's going to take us to get there, I think it'll take a bit of time. Like a lot of what we have to do in order to increase this asset utilization is a lot of business development. It's a lot of this coordination, like Olivier was saying, with all of the government departments to see what other products can we transport, who's going to pay for that. Lots and lots of coordination, which takes time. So I think that will take us at least a year to really start getting some good movement on our asset utilization from diversifying the products that we transport. And some of these other things that is within our control, I think these can be done a little bit faster, and we can use some interesting sort of methodologies and some operational processes to speed that process up, which is more in our control.
So I think the key message here on utilization, if you are looking at integrating drone transport, we highly suggest that you already have identified a pool of various utilizators. So people who are committed, so market commitment coming from different customers already. In that way, that will allow you to really raise that utilization rate quickly and enable then the cost sharing approach and so on. So that's really critical. Where we work, where there is no cell reception, that is a big limitation, and until the government is actively like looking at the root cause of that problem, and so talking with telecommunication and trying to improve the telecommunication network in that region to be able to address that lack of communication. Once we have able to communicate, then we can increase the utilization, just like Gabo mentioned.
Great, and we'll try Stephen one more time. Are you able to unmute yourself? If not, we can take another message from the chat. Okay,
All right.
doesn't look like it.
Doesn't work. Okay, go.
Another question that came in is people were curious about why you opted not to use a control region or control facilities in your evaluation. Can you guys speak to that point?
Dr. Arshima, do you want to take that one? I can try if not.
Yeah, please start and then I can add.
Sure. I think it was for a couple of reasons, and I will say I was not on the evaluation team, so we can get a more formal answer for this and send it back as well. But I think one of the reasons is because this is a process evaluation, and when you do a more process evaluation, you're really looking for what are some of the things that you can take really qualitatively throughout your implementation to learn about and to see how you can improve your operations. And so at this phase of work, when we did have a very limited scale that we could reach, which was honestly, a lot of it was due to, us doing this for the very first time. We didn't want to start with, serving 100 different health facilities right off the bat. We wanted to start small and scale progressively. And so having a control facility is really more important when you get into the impact evaluation territory. And we just weren't there with scale yet. But we have some exciting stuff coming up in Malawi that will reach that and have some control facilities in a randomized control trial. So we can maybe share a little bit more about that over the chat when we're done.
Yeah, it was more challenging for us to make a control group. Why? Because it was depend to the government will, which decided first which sites had to reach that we need to improve to introduce drone. So the list was short at the beginning. So we have already take all of those health facility to organize the drone distribution. In this way, we was not able to organize an audit trip and go to check where we can find the comparative group.
Great, thank you. Let's see. Another question we got was, can you speak to any supply chain intermodal research that's taking place, or kind of the idea that you'd want to use drones with other forms of transportation, or in complement?
Yeah.
Anyone want to take that?
Yeah, yes. I think as we mentioned during our presentation, the drone solution is just to supplement where we can use other mode of transportation. As I have mentioned as an example, for example, Botwali. Botwali is 200 kilometers far away from the warehouse. So to reach these locations with other mode of transport, you need to combine car, boat, and feet. So it will take a long time. That's why for this location, the government made the decision to use drone in this case. So that's where we'll go straight without using other mode of transportations.
There is a question here that's I think that people will appreciate. A question from Edgar Valdez. Is there an opportunity for certain medicines, such as those that require cold chain or extremely short storage, as an initial use cases? Indeed. So we publish a technical paper that really segment the type of product that we should prioritize with transport via drone versus land-based and more routinely. So product, as you mentioned, product that are dependent on cold chain, product with short shelf life, product that are small due to the limitation of the volume of the drone, actually with this kind of drone, and product that are unpredictable. The demand is unpredictable. Those are really the product that we probably would recommend starting with, having a frequent and demand transport for those category, for those type of product, while the other product, the one that do not require cold chain, the product that are bulkier, the product that we know better the utilization rate and so on, could be transported by land based on a less frequent basis. So definitely agree with this question. A sub question you had, while scalability and business model continue to mature to address automatical deliveries and get, yes. So and so that I hope that answered this question. Looking at other, do you see another one, Kat or Gabo?
There's a bunch of them.
Did we want to try Stephen again? Was he able to unmute?
I don't think he was, but it looks like Francis. Yeah, Francis is raising his hand, so I'll invite him to speak. So you should be able to unmute yourself now.
I think I did. Can you hear me?
Yes.
Yes, perfect.
I do exist. Hi, this is François Castel from Flying Basket in Italy. A question to the business case. I think I saw that you're wishing that the business case evolves from having all this paid for by donors and NGOs to a more standard business case where the companies, the service providers involved would basically bear the cost of starting it up. So my question has to do with what are the prospects for steady state business that a private entity could see and bank on in terms of having something that would be a safe and interesting investment as they consider the fairly high costs of doing business in that region of the world and of deploying fairly new technology there. So the question is really about what's the steady state business, what are the commitments that exist to that if a private entity decides to consider seriously investing in it and fund the startup costs.
Yeah, Olivier, did you want to take that one, or did you want me to start on that?
I can start. So as you saw, Francois, and this is linked a little bit to a question, another question from Jan Kriska, that it absolutely needed to switch to a multi-market penetration, market development, having customers from the health sector, but also from more profitable health sector, like the energy industry, the mining industry, the environmental industries, security industry, defense industries, and so on. So really diversifying your pool of customers and the type of customers. And in terms of interest, where we work in Mozambique, in Malawi, and the DRC, there's definitely an increased demand from private sector beyond health. And we see this is probably what is going to make the business case and the financial viability work, is by servicing, having those telecom, those mining, energy, and other sectors start using that additional mode of transportation, paying a certain price for it, and having the drone service provider basically subsidize for less profitable market, like the public health in this case. We are having discussion with many companies in the private sector beyond health who are interested to either outsource the transport to a drone service provider or finding different operation model. we believe that it is the future, and this is what we're going to be testing in DRC, in Mozambique, in Malawi, and helping others to make drone transport viable. I would also say transport, and even better, if you can add the use cases and if you have a platform that is that can do transport, but also search and rescue or mapping. There's a lot of demand and a lot of profitable, very profitable market there that you could cap on as well. So if you have or we know a drone service provider that can do multiple type of application, laying the use cases is also a good way to address this financial viability, affordability. I hope that.
Yeah, did that answer your question, Francois?
Yeah, okay. Yeah, thank you.
Great. Well, it looks like we're at time. I know that we have a lot of questions in the chat that were still not answered. So after this call, we will compile all of the questions and make sure that they all get answered, and we'll share them with the webinar recording. But a huge thank you to everybody who attended today, and thank you to our speakers. This was a really engaging conversation and discussion. And yeah, we look forward to continuing the conversation going forward. So yeah, thank you all for attending. And if you're not a member already, we encourage everybody to go join UpDog. So thank you all.
Thank you, everyone.